Thank you very much. Good afternoon, everybody. I'm indeed have the pleasure to be here and address the forum today. I doubt that there are many occasions that you have people from NASA talking to the forum, so it's indeed a great pleasure to be here. My presentation is titled Satellite Data Applications in Vector-Borne Disease Research. That is the more general version of the presentation. However, I'm going to dig deep into an application on Rift Valley fever that we have been working on for quite some number of years. But first off, before I continue, I want to give out a shout out to Pat Kelly, who is in the forum today, because his foresight and his vision enabled this work to begin to be operationalized about 18 years ago. So he deserves a point of thanks on that note. And also Dr. Ken Linthicum, who is not here with us. So to start off, I guess coming from NASA is all about data. And we have several data sets of the environments, of weather and climate that can be applied to various aspects of vector-borne diseases. This data includes sea surface temperatures. Right now we have about 35-year record of satellite observations of sea surface temperatures. We have about 37 years of global precipitation data. And now we have 16 years worth of land surface temperature data and 35 years of vegetation information. I took this data set as an example, particularly to show that the world's oceans are a major determinant of variability and trends in climates. The impact on the interaction with the atmosphere leads to precipitation, and precipitation basically affects land surface temperature and vegetation. And in doing so, it creates conditions under which different vectors emerge and able to propagate through time. Now, with all these massive amounts of data, what can we do with them? So the second thing is, how do we employ these data sets to particular specific problem dealing with vector-borne diseases? Of importance to most of the work we do is the whole idea of calculating anomalies. And anomalies simply tell you how are things different today or this month or this year from the long-term average. And that's why we require long-term data sets. So the data sets that I had explained before are very important for creating a baseline from which we can calculate these anomalies. Now, the anomalies themselves are not important, because you can have an anomaly today, either positive or negative, but the important fact about anomalies is they have to persist in time. So over here you are seeing areas that are brown. Those are areas of drought. And areas that are green and blue are areas where there is above normal response in vegetation and below normal response in vegetation. Those are areas that are normally wet. So both these signals, in terms of dry signal and a wet signal, both these signals are important in terms of creating conditions for vectors to flourish. And those are the particular metrics we use in terms of our modeling. Now, the case study I'm going to address is about Rift Valley fever. Just a few points about Rift Valley fever. Rift Valley fever is a viral borne disease that is spread by various types of mosquito vectors, including Culex and Aedes. It was originally discovered in 1930 in East Africa, in a particular region in Kenya called Naivasha. Observations where there was a huge episodic of on a sheep farm, and since then there have been occurrences of Rift Valley fever through time across the broad spectrum of sub-Saharan Africa. If you look on the top graphic, which is showing you the Southern Oscillation Index, this is an indicator of what is called El Nino Southern Oscillation. You see that areas in red, those periods we refer as to La Nina events, and areas in blue are the periods that we refer to as El Nino events. El Nino events are represented in the bottom graphics, and the signature representation of the El Nino event is this warming in the Pacific Ocean. That warming in the Pacific Ocean is also followed by a particular warming in the Indian Ocean. So in a sense, you are creating almost a seesaw pattern with cooler than normal sea surface temperatures in the area of Western Pacific, Indonesia, and on the other side, you have warming oceans. The effect of that in terms of atmospheric dynamics is to produce areas of cloudiness, which you see in blue, and in the Eastern Pacific, and in Eastern Africa, you also have areas of blue. And areas of brown in Southeast Asia are areas where you have no clouds, so you have drought. The tendency of this mechanism to occur with a periodicity of about 6 to 7 years is what produces then the El Nino cycle, the Enso cycle. And this same Enso cycle, when we look back into the disease record of Rift Valley fever, almost all Rift Valley fever outbreaks across sub-Saharan Africa have been associated with the El Nino cycle. Now, how do we capture this in terms of employing this into a model? The first critical component, you have to understand the behavior of the vectors that are infected with the virus. And these are primarily Aedes and Culex species. This graphic here is from work that Ken Linthicum had done at a location in Kenya, where they looked at a particular dumbo. Dumbo is the habitat where these mosquitoes usually emerge during the wet season. And they monitored what happens in terms of the evolution of the population of these vectors. And what they noticed at that time is that within about 10 days of flooding the dumbo, there is emergence of the Culex Aedes species in the first 10 days. That is shown in the blue line. And then afterwards, about between 5 and 30 days, there's emergence of the Culex species. These two species are very critical to the disease in that the Aedes species are the primary vectors. They infect animals, livestock, and then the Culex species are the amplifiers. So they will spread it to other animals or the human beings. And if you look about the ecology, during the dry season, these particular dumbos are actually patched up. So studies indicate that they can remain in desiccated soil for a period of 10 to 15 years. That may in fact be what governs the cyclic nature. And then on the bottom there is what happens during an epidemic when these dumbos get flooded. So this is the basic input or knowledge that we require in order to create a model. So about 18 years ago, we started working on this model, and basically we looked at the literature and tried to identify where there were epidemics in the past of Rift Valley fever. That area is shown in green. And to develop that area, first we inventoried the literature to find out what areas. The second thing is we use the climate information in terms of rainfall and vegetation to identify areas that have a signal of high interannual variability associated with El Nino. So when we run the model, we limit the results to that area shown in green. The other thing is we then determined what kind of threshold in terms of vegetation do we use? So that is explained there. I don't have to go into that. But basically we threshold those values and then run the model as a 3-month moving window, which is shown here. So you have measurements on the right, top right here, which is the monthly NDVI. On the left is the long-term mean. You derive an anomaly at the bottom, and then those are input into the model. And then the model is run as a moving window to look at the persistence of those particular anomalies. The anomalies that meet the threshold, those are then identified to be indicating of area at risk, in that those areas are where they are likely to emerge populations of RVF vectors. So we run it in time, and in this way we are able to capture the dynamics of the changing seasons and the changing months. So we get, when we get first 3 months, and then the following month we subtract the first month in the series and add in the present month, and we go through time in that particular way. So for example, on here, this is a summary map showing in red the areas that we map to be at risk, and green is that episodic area. And the different colors there show you where outbreaks happened between 2006 and 2011. If we consider the performance of the model, what we found from the analysis is that about 70% of the cases we had, the areas we had mapped to be at risk, where an outbreak occurred in terms of case reporting. For East Africa, it's 70%. For Sudan in the north, it was about 50%. For Southern Africa, we had a lower performance of about 30%. And there are more factors that are involved in terms of outbreaks in Southern Africa that I won't dwell into right now. But the important thing is to remember that the dynamics that went into setting up the model were based on that graphic of mosquito population dynamics that was based on the studies in Kenya. So in fact, in order to find out exactly what is going on for Southern Africa, right now we have a project going on that is led by Billy Karesh from EcoHealth. It's a project, Rift Valley Fever in Southern Africa, that is going on right now, and we are gathering information on vectors, on wildlife, on human population, on livestock, and we are hoping that that kind of information from doing this multidisciplinary comprehensive study is going to provide us more information in terms of setting up a model for Southern Africa. The other thing is those outbreaks shown in yellow up north there in Mauritania. Those are actually lying outside of what we had classified as an episodic area. So this may be telling us that our episodic area map is not very well defined, or this is a new area where Rift Valley fever is expanding, as also we have seen in parts of Saudi Arabia and Yemen. Now, how do we share information? This project is funded by the Department of Defense, Defense Health Agency. So our first customer is the Department of Defense. And why are they interested in that? Is because of protecting deployed or deploying troops. So that information goes to DHA. We also share information with the United States Agricultural Service and APHIS in order to be able to do homeland protection for incoming commodities, either in ships or by aeroplane. We also provide information to WHO, who are concerned with human health. The information also goes to FAO, livestock health, and OIE on livestock trade. So you can see that our approach is a really comprehensive One Health approach. Besides that, the information goes to other US government agencies, including State Department, because if a country is in a particular situation and they need help, that has to be put through the resident ambassador in a particular country. This information is also shared by the Pandemic Prediction and Forecasting Group, which is an interagency working group under the Office of, I believe, Office of National Science and Technology Council. It is under the White House. So we share information with them in order to be able to filter the information up to the higher levels of government and all these other government agencies. Up to now, we have about 25 unique recipients of our information. What usually happens during high-risk periods like the period we just are going through right now, we also provide these Google format maps. These are especially important for people who are going to do field surveillance. So for example, the US Army Lab in Kenya will require these maps in order to pinpoint exactly where they should go and do early surveillance. And also other partner government agencies receive this information. So this example here, I just show you, for example, how the early warning can help in terms of being able to carry out preventive measures. These graphics are from the outbreak in 2007, and they show you, for example, in Kenya, we gave the first early warning about 3 months before the first outbreak occurred. In Tanzania, it was about 5 months. Sudan, it was about 5 months. If I take the example of 2007 outbreak, you will realize that the response at that time was about 2 months earlier than during the huge epidemic in 1997-98. For this particular year, I would say the information we are getting is very positive because we gave warning up to a year ago, and so far in the episodic area we have not had any reports of Rift Valley fever activity. However, there was an outbreak that happened in southwestern Uganda, which is outside of that green area. So the important thing to remember here is that this kind of information can really narrow the gap and move the response curve to the left, as had been shown earlier in this morning session. Besides that, we are also providing global alert reports. These are custom-made reports that we write for Armed Forces Health Surveillance Center of Department of the Defense Health Agency. These go to them and then filter down to other users. And we produce these maps especially during a high-risk period. So for example, and this was published in PLOS, the map at the bottom is showing you what we had assessed to be risk of various disease outbreaks in various regions during the El Nino period. Now, during this period, we have been following up on knowing exactly what happened. And this map here shows you the precipitation anomalies during November to January 2006. And the map below shows you the information we have collected and your reference showing various outbreaks that have happened in various regions. For example, in US, we have had hantavirus. In East Africa, we have had a huge epidemic of cholera. We have had dengue and Zika in South America. And we have had various outbreaks of dengue fever in Southeast Asia. So that is how we go about being able to validate whether what we had given before. However, remember that that is all based on understanding what happens during an El Nino event and what kind of realizations in terms of precipitation and temperature anomalies you are going to observe at a particular location. And I just wanted to point out that this is what is happening right now is not new, because just a couple years ago, in 2011, like for example in the US, we had a very big, large-scale outbreak of West Nile virus. And if you look at the departures in land surface temperature on the bottom left, you can see that there was a shift in the seasonal temperature anomalies. In Southern Africa, we had a Rift Valley fever outbreak. You can see a shift to the left, cooler than normal temperatures. In Australia, we also had an outbreak of Murray Rift Valley fever. And same as in South Africa, you have this shift in temperatures. This is just to illustrate that the climate component is an envelope that is underlaying all these perturbations in terms of disease outbreak we are observing from time to time. Now, in terms of big data, you may say what I presented was on big data, but for us, real big data is this data that is now coming online from NGA. This is data that is between 0.6 and 4 meters. And we are compiling this data set for the entire world. What I see in terms of applications of vector-borne diseases, I think this data can be interrogated to look critically in detail at particular zones of outbreaks. For example, where Ebola occurred or where Rift Valley fever emerged. So we can observe exactly what is going on with the changing ecosystems in these locations. Now, just some take-home points from this is just that the understanding of departures in either direction, whether positive or negative anomalies in temperature and precipitation, have important implications for vector-borne diseases and emergence and spread. Currently, the magnitude of El Nino or Enso cannot accurately predict the amount of rainfall. However, we can use the template in terms of the average history of these events to make statements about the occurrence of particular diseases in particular locations. And as I have just illustrated, because there is always a gap between when it starts to rain and when the first event occurs, I believe that as a community, we have a really good time gap where we can exploit to be able to take preparedness measures and also control. From this work, one thing we have realized that early ground surveillance is very important. And for example, deploying field diagnostic capabilities, this can enable early identification of the virus and be able to then put mechanisms in place to do something about it. And from the outbreak information side, right now, and I think Simon had raised that in the session earlier this morning, there is really need of georeference outbreak information, because right now most of the information we get is not georeferenced. And I know that this is a big challenge to the community, but it's imperative that in order to improve models or to build new models, this kind of information has to be georeferenced. Having country level information is not good enough, because if you look at a large territory like Brazil, if you tell me that there were particular cases of Zika or dengue outbreak in Brazil, the ecosystems in Brazil between northern Brazil and southern Brazil in terms of the response to climate are quite different. So it's important to have really good georeference information. And probably the last take home for all of you is that we have available large amounts of remotely sensed data that can contribute towards these efforts. Thank you very much.